Hi, how can I help you?
For 15 years, it's been Annie Collins welcoming women into the abortion clinic in Queanbeyan.
I love it because every day is different.
But she fears her days supporting patients here are numbered.
So we would be doing 15 to up to 21 terminations a week. Now we're down to maybe 3, 5, or 7 perhaps.
The dramatic drop has pushed the clinic to the brink of closure, and it's the availability of free abortions over the border in the ACT that's to blame, because women who can are understandably choosing the no-cost option. A medical abortion can cost up to $400, while a surgical procedure can be more than $2,000. To be eligible for a free abortion, a patient must live in Canberra. In the first 14 months, more than 1,500 people accessed the no-cost scheme, either through MSI, formerly Marie Stopes, or a participating doctor. And demand is expected to double this financial year.
From here, the challenge is how we sustain it, how we look at sustainable funding, how we meet demand for the model, how we support our GPs in the community and MSI to do that.
Canberra GP Jessica Titterman sees the publicly funded service as a huge win for the capital, but is deeply concerned about the abortion clinic in Queanbeyan closing its doors.
It is a really unfortunate, I'm sure unintended consequence that then further limits, if that service does close or is no longer able to continue providing these services, further limits choice.
And Dr Titterman says a stark inequity has also emerged between women who live as little as 10 kilometres apart.
This is particularly stark because, Queanbeyan is so close to Canberra and so many of the surrounding New South Wales towns where we often have a more fluid relationship for healthcare, and this is a hard line that has been drawn.
The closure of the Queanbeyan clinic would likely prompt a jump in demand at MSI Canberra, which is already at capacity.
We could take on more people, but we would also need to get more doctors.
Which is not an easy thing in Canberra.
No, that's right.
The ACT government told the ABC access to abortion services for New South Wales residents is a matter for the New South Wales government. A spokesman for the New South Wales Health Minister Ryan Park said more than $4 million had been allocated to improving abortion care, but failed to clarify whether any of that funding would support the clinic in Queanbeyan or women living across the border. Rosie King, ABC News, Canberra.